Hope you are enjoying good health. Today the topic of discussion is children growth. So the question is, why is measurement of growth important? The answer is, the measurement of growth is one of the most sensitive indicators of child health. Child growth is called the mirror of the society and takes a leading position in the available measures of nutritional status. The pattern of human growth is unique and is negatively affected by environmental factors such as infection and food insecurity. In these conditions, a child may be undernourished, he may be wasted, but the length or height of the child is not affected by the environmental factors and infections, and also with the food insecurity. The most common measurements taken are height, weight, walk. I discussed these earlier in my previous sessions. Vitamin and mineral deficiencies, and dietary evaluations. By using height and weight, we construct three main indicators for child nutritional status. These are weight for height, height for age, and weight for age. Vitamin A, iron deficiency anemia, iodine deficiency, and zinc deficiency can be assessed biochemically, and methods of assessing dietary intake are varied and include determining past intake and present intake. So dietary evaluations, I also discussed these earlier. What are the dietary methods and how we can measure them and how we can interpret the data. All these topics are already discussed. This is the normal pattern of height growth for girls and boys from birth to adulthood. See, this dotted line is for the girls and this solid line is for the boys. It represents the growth in boys and it represents the growth in girls. Now see this. This blue circle represents fast growth in infancy. When the child is less than 2 years of age, he grows more rapidly than usual. This red circle is long period of steady growth from age 2 to 10 years. This is from birth to 2 years. This is from 2 years to 10 years. And this green and yellow circle is the period of faster growth associated with puberty. This purple circle indicates the final height of boys and this is for girls. Final height of boys is greater than that of girls and this is the rapid increase of height in boys while the height of girls remains stagnant. Adult height within a population tends to be normally distributed but may be slightly differ due to the genetic effects. Most probably, tall parents tend to have taller children while short parents tend to have shorter children. There will be some tall people, some short people, but most people will have a height close to the average. The data against which anthropometric measurements taken in the field can be compared are called child growth reference curves or growth standards. There has been considerable debate about whether these reference data should be constructed for each nation or population group separately, local based data, or whether one set of international data should be used. There has also been a debate about whether these comparative data should be called references or standards. So it was argued that due to genetic differences between populations, international reference data is inappropriate. But there is strong evidence that child growth is largely determined by socioeconomic status rather than ethnicity, and that the growth of children living in high socioeconomic environments all over the world are very similar. It is useful to have one child growth reference data set to allow for international comparisons of growth. The term reference indicates that the data are a tool providing common basis for purposes of comparison. In contrast, a standard implies a norm or a target. So, WHO set up the multi-center growth reference study to generate growth curves for assessing the growth and development of infants and young children in the world. Reference data was published in 2006. Resulted from the study of children in 6 different countries that are Brazil, Ghana, India, Norway, Oman, and USA. So these are some of the countries are developed and the other are developing. So it's a combination of the countries. The aim of the new growth curves was to provide a single international standard of the best growth patterns for all the children from birth to 5 years of age and to establish the breastfed infants as the normative model for growth and development. For children older than 5 years, a reconstruction of the 1977 National Center for Health Statistics was carried out. So these are the growth curves and charts developed by WHO, and these are used as the reference data for measuring the growth of the children. I discussed these charts and how to read the Z-scores in my previous session in detail. So what are the cutoff points? WHO cutoff points for undernutrition in children. The WHO recommends the use of the WHO child growth standards and cutoffs for undernutrition based on the Z-scores. Detail was discussed in my previous session. Here is the summary of these Z-scores. Z-score below -2 are markers of undernutrition. Between -2 and -3 are termed moderate undernutrition, and below -3 are termed severe undernutrition. These are the 3 main indicators: weight for height, height for age, weight for age, and these are the cutoffs of Z-score. If the Z-score of a child is less than -3, then we say that the child is severely wasted if it is for weight for height, and severely stunted if it is for height for age, and severely underweight if it is for weight for age. And if the Z-score is -3 to -2, then the condition may be moderately wasted, moderately stunted, or moderately underweight. Similarly, less than -2 indicates wasted, stunted, or overweight nutritional status. So what is the public health significance of these indicators? Levels of stunting and underweight are considered a public health concern when they reach above 20% and 10%. Above 20% for stunting and above 10% for underweight in a population. As wasting is a measure of acute undernutrition that has significant negative health consequences. So if these are less than 20 and less than 10 prevalence in a population, then it seems to be normal. But if it exceeds, then we say that the problem is at a median level or high level, is at a very critical stage. Prevalence of wasting in a population is, here we discussed about stunting and underweight, and now the prevalence of wasting in a population less than 5%, then acceptable. Above 5%, it means that it's a public health problem, it's a public health concern, and more than 15 indicates the critical situation of the wasting in the population. So this is for today. If you are new visitor on this channel, then subscribe the channel and press the bell icon, share the video and like it. Thank you.